Thank you all very, very much. My name is Alister Martin, and I'm an ER physician and CEO at A Healthier Democracy. I'm going to tell you a little bit about the work that we're doing at the intersection of healthcare and voting. But before I begin, I want to tell you a quick story. It was 2 a.m. on a Friday night, and I was at Boston Children's Hospital in the emergency room about 7 years ago. I had a young woman who came into the hospital who was in her early 20s. She came in with her 2 young children, both of whom were younger than the age of 3. She told me a story I'll never forget. She said, "Doctor, about 4 months ago, I left an abusive situation with the significant other, the father of my kids. It was dangerous for both my kids and myself, and so I moved us to Boston, to the only family that I had, which is an aunt who lives in the city." She said, "Doc, over the course of the last 4 months, things have been okay, but over the course of the last 2 days, because of her own mental health issues, she and I got into it, and she actually kicked me out and the kids out on the street. And yesterday, we spent the day in our van in the cold. Tonight, we were going to do the same thing, doctor. It was 2 degrees outside, and I looked back, and I saw my toddler, my young two-year-old, shivering in the back seat, heard his teeth chattering, and I knew there was no way I was going to do that to him again. So I came here because I didn't have anywhere else to go. Can you help me?" For the clinicians in the audience, you'll recognize this feeling of what the patient asks of you and what you know the healthcare system can deliver, that discrepancy. And it hurts in those moments. And I remember telling her, of course, I didn't say any of that to her. I said, "Of course we're going to help you, don't worry about it." And so I stepped out of the room and did what any self-respecting ER physician would do. I called social work. And I got on the phone, I said to the social worker, "Listen, we got this young woman, she's in her 20s, she's got her 2 kids. It's 2 degrees outside, and I'm not going to discharge her. And the shelters don't seem safe for her 2 children. What can we do?" Social worker says, "No problem, we'll take care of it. We've got a state-based program that we can actually get her in, transitional program, if she's a Massachusetts resident. So she needs some proof of residence, like a check stub or a phone bill, and if she has that, then we can get her into this transitional housing program." I said, "No problem." Go back to the patient. I said, "We can definitely help you. Do you have a check stub or a phone bill?" The patient says to me, "No, doc, as I just told you, 4 months ago I moved to this state and I don't have any of that stuff." I said, "No problem. Don't worry about it." I take a step out of the room. I call the social worker. She doesn't have any of that stuff. She doesn't have a check stub or a phone bill. What can we do? The social worker says, "Well, look, there's nothing we can do." I said, "There's got to be something." He says, "Okay, well, there's one thing that we can do. We can register her to vote. Her voter registration would count as proof of residence in the state of Massachusetts." So 2 things happened to me, NextMed. The first thing at this time was I immediately, on the phone, said, "Is this legal?" The second thing was I left my education at Harvard Medical School as a medical student for 2 years, and I went to go to the Harvard Kennedy School to learn government and ostensibly to learn about public policy, and I had never learned that voter registration was legal in healthcare settings. And of course, the social worker said, "Yeah, it absolutely is legal. The National Voter Registration Act of 1993 legalizes and encourages hospitals to do voter registration. So Harvard, if you're listening, I want my money back." So I go back to the patient's room and I say to her, "Look, we can definitely help you. I have a sort of an unusual question for you, though. Do you want to register to vote?" And what she told me, I'll never forget. "I didn't know I could. No one has ever asked me that before." We got her registered to vote. We did get her into transitional housing. But the gears began turning for me, NextMed. How many of the patients that I had seen at that time were in a similar predicament, who felt on the outskirts of our democracy? She wasn't alone. In this country, there are 60 million people who are not registered to vote, but who are eligible. That's the entire population of the country of Spain. And when you ask people, "Why are you not registered to vote?" the vast majority say, "No one has ever asked." And so you see, we have an opportunity here. We have a demographic overlap. Those who are unregistered but eligible voters, and those who, quite frankly, are screwed by the healthcare system, the most marginalized. Okay? They tend to be younger, they tend to be lower income, and they tend to be people of... These are people who come to my ER not because they have an emergency, but because they need a work note so they can get back to work, or so that they can get a prescription because they can't get a primary care doctor. Isn't this an opportunity to potentially use the healthcare system to invite these folks into the democracy that we all work to create, and to do so with trusted messengers like doctors, nurses, et cetera? So what's the so what of this? Why does this matter? This matters because when people don't vote, they're labeled as unlikely voters, and campaigns don't make contact. The candidates that are running for those offices, like senator or congressman or mayor, they don't listen to the perspectives of folks in those communities. Their perspectives, their concerns, their questions are not baked in to the policy platforms if and when those people become elected officials. And this has ramifications all across the healthcare system. Every city that we have looked at, we find the exact same pattern I'm showing you here. Let's look at East Harlem back in 2018. This very specific precinct had a 35% lower voter turnout rate than every other part of the city. Correspondingly, that same exact precinct, nearly 20-year life expectancy drop-off in the same exact district. You say, well, no, this might just be a New York City phenomenon. Let's look at Detroit. This little corner of southwest Detroit has 24 industrial sites. These are chemical plants, these are asphalt plants, these are oil refineries, polluting the air and the streams in this part of Detroit. As a result, people who live in this part of Detroit live 7 years less than the rest of the country. They present to the ER with myocardial infarctions at higher rates, and for asthma at higher rates. When we look at that corner of southwest Detroit, are we surprised to find that it has the lowest voter participation rate across all of Detroit and also across all of Michigan? My answer would be no, but let's tie it back. Those industrial sites had to go somewhere in Detroit, didn't they? Where did they decide to put those industrial sites? Where they know people are not, okay? They're not going in the places where people are making their voices heard. Do you understand? And guess what? For the clinicians in the audience and the healthcare organizational leaders in this audience, we got to clean up the result of that, okay? And it's not just cities and states. There's whole regions of the country. Look at this pattern. These are the stroke belt states. In these states, there's a higher preponderance of folks who have strokes and who die from stroke. They're the same exact states that got dinged in the 1965 Voting Rights Act. Why? Because these were the exact states that had a legacy of voter disenfranchisement. These are the exact same states that were not able to change any of their voting policies because ultimately the whole legacy of those states was to restrict access to the vote. They're the exact same state. You look at every single one of our measures that you look at health outcomes through, the same pattern exists where voting rates are low, so are health outcomes. Okay, so what do we do to reverse the cycle? We've got a downward spiral. How do we sort of flip the script, right? Create a positive virtuous cycle. We help people vote. We help people vote. Why? Because when people vote, they're labeled as likely voters. Campaigns make contact. They listen. They hear the perspectives. They include these perspectives into the policy platform. It's not rocket science. What we do with Vote ER is we have 3 different levers that we pull to help healthcare providers and healthcare systems register folks to vote. The first is what I'm wearing here. This is a Healthy Democracy Kit. So when I go to my shift on Thursday night, after our cacao ceremony, is that tonight or is that on Thursday? I'm not sure. These Healthy Democracy Kits, right, have a badge on the back of my ID badge, which allow patients to check their voter registration and register to vote or get a vote by mail ballot. These lanyards are what we call in behavioral science visual triggers. So patients will ask, hey doc, why does your lanyard say vote on it? And I'll say, well, it says vote on it because I want you to take 30 seconds to check your voter registration. We have 50,000 physicians, nurses, and social workers wearing these across the country. Next, we create posters, handouts, discharge paperwork, like you see here, which allow hospitals and clinics to register their patients to vote. Not only that, we allow all of the hospitals to track and see how many people they've registered to vote. So we can have Mass General compete against Johns Hopkins, and UCSF compete against UPenn, and it gets feisty. Lastly, we work with community health centers to register people to vote via text message, as you see here. We've sent millions of text messages and helped lots of patients register to vote via this program. Let's go over to Ohio. This is Dr. Stager, who's a pediatrician in Ohio, and she uses our scripts in her social history. She asks her patients, do you smoke? Do you drink? Are you registered to vote? As simple as that. 50,000 physicians like pediatricians, clinicians like nurses, social workers, residents are using these kits all across the country. Let's go to North Carolina. This is Dr. Smith. She has a private practice, and in her private practice, she uses our posters, our discharge paperwork, our handouts to help patients who are in her waiting room register to vote. There are 700 hospitals and clinics like Dr. Smith's across the country. You guys heard about Dr. Steger. Let me tell you about one of her patients. This is Lauren. She's 19, she was 19 at the time, and Dr. Steger helped her register to vote for the first time. Now, that's a cool story, and we sort of could like congratulate ourselves and pat ourselves on the back there, but what happened next is even cooler. Lauren went home and helped her sisters and her parents register to vote for the first time, and as a family, they voted for the first time. This is the power of just one clinician. This is the power of just one clinician and how the effect not only can shift from the individual, but to family systems, getting communities out to vote. And so in summary, we've helped 80,000 folks across the country with vote by mail ballots, voter registration. We've helped 50,000 clinicians across the country get these kits to help their patients register to vote, hundreds of hospitals, and lots of associations and organizational partners across the country. But did these people actually vote? Did folks actually go out and vote on election day? The data has been astounding. The turnout rate of the folks that we helped to vote was 85%. That's nearly 20 percentage points higher than the average voter. There's something going on here. There's something about when your doctor talks to you about registration, or when the facility that takes care of you talks to you about voter registration. It's memorable. There's something about it that makes you more likely to actually vote when it comes to election day. But here's the part that I find most interesting. The effect was most pronounced on low propensity voters. These are people who have never voted before, or these are people who have voted very infrequently. There's something about this intervention for that group in particular that really gets them out. But it's not just about mobilizing individual clinicians and individual patients. We've also got to work with systems and organizations and build coalitions to do this work at the grass tops level. Back in August of 2020, we launched the first ever Civic Health Month, which is a national celebration of healthcare-based voter registration during the month of August. This coalition has been hard at work. The coalition together has put pressure on and worked with groups like the American Medical Association to pass and proclaim voting as a social determinant of health. Why is that important? That's important because hospitals and medical schools now, if they're trying to address the social determinants of health, well, the question becomes, what are you doing to help people vote? We work with HHS and VA to make sure that they have implements best practices, and they have an understanding of how to use some of what we've learned in the over 17,000 federally qualified health clinics to do voter registration across the country. And we've also worked, as you just heard about Civic Health Month, we've also worked with states all across the country to get governors to proclaim Civic Health Month. This is back in Massachusetts, and we're working with states all across the country to do the same exact thing. So what's next? For those of you who are not checking your calendar, the 2024 presidential election is what's next. There's a number of opportunities to get involved. Patients, clinicians, you can help your patients register to vote. You can go to voter.org/kit. You can get one of these kits. These are free. You're going to have a kit that will help you check your own voter registration, but not only that, you'll get a way of tracking your own impact and seeing how many patients you've registered to vote. Healthcare organizations like hospitals, startups, established organizations, you all can help your employees register to vote, and also help patients, those that you serve, register as well. You can join us as a Civic Health Month partner in 2023 and help us do this work across the country. And then lastly, clinicians, if you're interested, if this resonates with you, come to our Civic Health Conference. It's on March 31st, 1 o'clock. We'll see you there. It's virtual. Lastly, we got to make sure that the clinicians, the physicians in the room looking at you, you are registered. Why? Because study after study has shown that we do not vote. This study in 2004 demonstrated that physicians vote at 10 percentage points lower than the general population. You don't want to know how much lawyers vote. They were like 22% higher than the general population. So you might be thinking, well, a lot has happened since 2004. This is probably no longer accurate. Unfortunately, not only is it still accurate, it's worse. This study was done just 2 years ago, which found that physicians voted at 14% lower rates than the general population. So we've got to clean up our own act. I started with a story, I'll end with a story. Before I left for DC, I was taking care of a patient who was in her early 20s, this Latina woman who was in with shortness of breath and a cough. It was very clear she had an asthma attack. We gave her some albuterol, some steroids, got her feeling better. And I had a little time that day, so I went back and discharged her myself. She saw my lanyard. She said, "Doc, why are you wearing that lanyard? Why does it say vote on it?" And I said to her, "Well, it says vote on it because it's very important that you take some time to check to make sure that you're registered to vote. I don't care who you vote for, but we have a big election coming up, the Boston mayoral race." And she said, "Doc, voting is not going to help me." I sat down and had a conversation. I said, "You see how you're here with asthma, right?" She said, "Yeah." I said, "You have asthma because the community that you live in has toxic smog and pollution. You live near an airport that has polluted the air and driven up the rates of asthma in your community. And when you come in here, of course I'm going to help you with your asthma. I'm going to give you a prescription for albuterol or steroids. But I can't take the smog out of the air. I can't remove the smog and the air pollutants that you breathe. You can do that by voting. You can do that by making your voice heard." We were able to register her to vote for the first time, and she was able to make her voice heard in that election. What I'm here to tell you all is that healthcare workers can help create a healthier democracy. We cannot do it alone, but without us, it cannot be done. Thank you all.
I am such a fan. Mine isn't tracked because I got I had one of the very first early ones.
The OG badge.
Yeah, but I will tell you, so this has been so profoundly impactful for me. I have become a voter registrar. So not only do I help people get registered to vote, like introducing them to it, but I'm actually now one of the registrars. And you're talking about, so many times people ask clinicians, like, we're so pressed for time. This is a great way to involve all of our students. It is a great way from the standpoint of, we would like to not have waiting rooms. We would not, but we do. We do, and this is a really perfect time. And what I have found in my own work is that it's super easy to put into the script. When was your last vaccine? How much do you consume of alcohol every single day? Are your guns safely stored? Have you registered to vote? It is like a no-brainer.
That's right.
When we first had our conversation, the piece of information that really galvanized me was the number of people who said they'd never been asked to vote. And what I realized is that I come from a place of privilege.
Right.
I mean,
right.
I couldn't wait for the day that I got my driver's license. And there was a really big moment of having that driver's license, getting ready to counting the days, like, now I've got a driver's license, I can register to vote. I didn't realize what a place of privilege that is.
Right.
So your work is extraordinary. I'm so glad that you brought your executive director. Aliyah Bhatia is here. Do not leave without making sure that you check your own registration. Come up and scan that, but get one of these. As far as next steps, Civic Health Month, you talked a lot about medical schools. Nurses outnumber you.
Yes. 7-1.
Yeah, I was going to say there are 4 million of us.
Right.
They're just so in that ask as far as engaging clinicians, everybody. It's interesting that most people in this country are somehow or another related to a nurse. So there is a nurse in your life that you know really well. Check with them and make sure that they are active in helping to bring more people to voting. So with that, I think we need to go on.
Thank you so much.
Yeah. So thanks, guys.